All right, so I'm back with another update. I do apologize for my appearance. I just left the gym, so I'm sweaty, I'm flushed, and I haven't been getting sleep, so bags are very heavy. Anyway, so just a quick recap of or why I'm doing this, because I sometimes when I review the video back, I realize I left a lot out because I freestyle these videos because they're at a spur of the moment thing. I keep saying I'm going to take notes, but I have not done that yet. So hopefully next time, if I review this video and realize I left something out, then I promise to take notes so I'm more informative or don't leave anything out. So just a quick recap of why I'm doing this. I am 20 weeks pregnant, so we're at the halfway mark officially. Well, I'll be 20 weeks Friday, to be honest, but every time I go to an appointment, I measure like 4 or 5 days in advance. So if it's a Wednesday, they always say I'm the following week and 2 days in advance. So technically I'm already, well, not technically, I'm technically 20 weeks Friday, but by the size of the baby, I'm already 20 weeks. So anyway, so we're at the halfway mark. I'm 20 weeks, and I'm doing this video because I have lupus, and I also received a kidney transplant. And I don't know if I know I mentioned those in the first video, but I don't know if, if I recap. So yeah, I was diagnosed with lupus at 8. I started getting sick at 7. This was, over 20 years ago, almost 30 years ago. Oh, I'm old. So back then technology wasn't the greatest. So yes, it took them a while to diagnose me. Even now with technology being 100 times better, well, I don't want to say 100, but with it being 10 times better, it still can take a while to diagnose lupus. I know some women who they had been having symptoms all along, going to the doctor. My lips look horrible. I've been going to the doctor for months, and it wasn't until they got pregnant that the lupus showed up on the test. So besides all that, I don't want to get off topic. I started getting sick at 7. Took them a long time to diagnose me. I'm talking about weeks in the hospital. I would go in, come home, go in, come home, go in, come home. They thought I was better, come home. As soon as the antibiotics or whatever they gave me wore off, I was right back to spiking of fever and having all the symptoms. I was 8 years old. A doctor from California just so happened to be visiting one of the local teaching hospitals here where I was, and he was visiting for whatever reason, went over all of the details of my case and wanted to do a lymph node test. Took my lymph node out, tested it, came back positive for lupus. So thank God for him. So yeah, I was diagnosed at 8, received so anyway, fought that was hard. And lupus was attacking my organs. I don't know when it started, because you all know, if you have it or know anyone with it, lupus is silent. It shows itself on the outside with certain things, but it doesn't show what it's doing to your insides until it's too late. So yeah, when I was 12, it attacked my kidneys. Got a transplant. Then about 10 years later, started getting sick again. I did really well with that transplant. Lupus stayed, low and submissive. Did I just say submissive? Okay, sorry. Lupus stayed low. And I'm not editing anything. I don't have time for all that. So you'll get what you'll get in this video. So yeah, and it rejected at some point. It was time. Not saying that it was supposed to reject, but I just had a lot of stuff, going on. I was younger. I took care of it. It wasn't anything like that, but I was younger. So either way, had that transplanted kidney rejected. I got another one when I was 20. 4. Mind you, that one lasted, the first one lasted about 10 years. So either way, here we are still with that kidney. That one, from the studies, everything isn't 100%, but they think this is going to go well and over beyond 10 years. Some doctors that I see my case are even hopeful that it can go forever. But besides all of that, yes, this is why we're here. Pregnant with lupus as well as kidney transplant. So if anyone is in that situation, or if anyone is pregnant just with lupus, or if anyone is pregnant just with a transplant for whatever reason they needed a transplant, here we are. Because of those two conditions, I am high risk for preeclampsia. I'm high risk for preterm labor. I was high risk for genetic things, genetic abnormalities, being wrong for the baby. And I don't want to say I was, like, there's never not a risk, but so far with every test that they've done, everything has come back negative. So from what they can see on the ultrasound and what they can see through a blood test, baby's completely healthy. So thank God for that as well. So right now we just have to worry about the preeclampsia and the preterm labor. And also preeclampsia can cause preterm labor, and both conditions that I have make you higher risk for those. So that is like, I have it 10 times whatever on top, I am messing up my words today, on top of, I already had a baby almost 3 years ago, developed severe preeclampsia out of nowhere. And when I say out of nowhere, I don't want to mean that it wasn't expected, but it just came like suddenly. So once you've already experienced preeclampsia, then your chances increase by 30% of having it again. So that's what I mean when I say the odds are really against me. But I'm trying to do things this go around to see if we can beat those odds. And that's also why we're here, to help someone else who may either be pregnant, trying to get pregnant, will be pregnant soon, who are in the same situation that I'm in. And even if you don't have lupus or transplant, but for whatever reason, it could be any other reason why you're high risk for preeclampsia, this video can still be helpful. If you already had preeclampsia before with the previous pregnancy, like I said, your chances are higher of it happening again. So if this is successful, this may help others who are in this situation. So basically, I had my anatomy scan last week. Everything was perfect. Baby's doing perfect. Like I said, she's measuring it's not crazy ahead, but I'd rather have her ahead than behind, because if my chances of having her earlier are increased, and she does come early, which I pray she doesn't come too early. Oh my God, I just said what I was having. Whatever. It's a girl. So if she comes early, and I pray it's not too early, at least she's above, she has that, more, a little bit of weight or inches or whatever to help her out. But I know I won't go full term as in 40 weeks because the doctors won't allow me to. But if we can beat preeclampsia, the plan is to get at least to 37 weeks. So that'll still be considered, full term. I just don't want to come how, I had my son, which if you watch the other video, I had him at 33 weeks. And we did NICU and all that kind of stuff. So I just want to avoid that here in Florida. And it could be anywhere else in the world, I don't know. I'm just talking about Florida. If you make it to 35 weeks and baby's completely healthy, that boy's out in NICU. But even if you have your baby at 33 or 34 and everything's fine, they're going to make you do NICU regardless. It's just, even if it's a day, they have to take the baby to NICU. And I think if it's 35 weeks, in some cases, if one little thing is wrong, they're going to take the baby down to NICU just to spend the night. Is protocol for most hospitals here. And I don't know everything 100%, so don't come on here saying no, that's not true. I'm just going by what I was told by my doctor, and why he wants to get us to at least 37 weeks, but if not, prayerfully 35 weeks, to avoid NICU time and get, you know, the baby here as late as possible, because, you know, the longer they're in there, the better it is. My son was born at 33. He was completely healthy. He was just really small, so we had to stay in the NICU for about 4 weeks to get his weight to at least 5 pounds. And the reason why it took so long, because, you know, well, number one, babies don't gain that much weight fast. That first week they really kind of lose weight, and then he hadn't developed his sucking skills yet. Apparently that comes at 34 weeks or 35. So they had to teach him how to suck. So the first 2 weeks he was feeding out of a nose tube. They used a pacifier to train him to suck. Once he got that under control, then we started to use a bottle. I breastfed. I pumped 100%. So even when they fed him, it was my breast milk going through the tube. So the nurses and the doctors say that helped him gain as well, me doing breast milk. And nothing against anybody who can't. I'm not one of those people who are against people who can't or don't decide to breastfeed. I was just going off my story. And so as far as that's where we are. But so yeah, baby's doing fine, thank God. We're at 20 weeks. Everything's going great with the baby. Everything's going great with me. That's important as well. Blood pressure is still staying good. I had an appointment with my nephrologist as well last week. That's my kidney doctor. Still no protein in the urine. He was happy with all of my levels. The only thing he wasn't too happy with was my magnesium, which was kind of low. So I'm now taking magnesium supplements, and I'm borderline, how can I say it, diabetic, and I've never had risk of diabetes before. So I'm going to take a test tomorrow at the doctor's office at my OB to see if I'm gestational, or if I have gestational diabetes. So let's pray I don't, but if I do, you know, that's just something else to add to everything else that's going on. So that's the only two things he was, you know, worried about. Other than that, he's completely happy in the directions that things are going, and he's also on board with keeping me pregnant until at least 37 weeks, as long as my body allows it. My nephrologist, my OB, and my MFM, the high risk OB, they are all working together. So they always tell me to deliver the message, but when I go to my appointment, it's already been delivered. Because actually my nephrologist told me that. Then the next day or 2 days later, I went to see my high risk doctor, and they were saying, oh yeah, you're borderline, you know, diabetic, so we're going to have you go get tested next week. And they didn't do my blood work. That blood work came from my nephrologist. So yeah, they are all working together, which makes me feel better. So also, if you do decide to get pregnant or are already pregnant and you have, you know, complications, that's very important. Make sure your team of doctors are on the same page, because if you go to, I think the first video I recorded, it is kind of long. It'll tell you how all my doctors were on the same page until the day of my emergency delivery, and that's when things kind of went left, right. Nobody was on the same page with having me deliver or having me wait. But that's a whole nother story. Don't have time for that. Just go watch the first video. So yeah, so that's that. Let me just double check, because this was just supposed to be an update. So yeah, had anatomy scan. It's a girl. I mean, I wasn't trying to keep it a secret. I just try to keep my life as low key as possible, but whatever. I'm shooting a video on YouTube. So it's a girl. I already knew it was a girl. I found out it was a girl at 14 weeks. We did a private gender reveal, but my anatomy scan confirmed that it was a girl. Baby girl is doing really, really well. They were very, very happy. My nephrologist was happy with my blood work with my kidney function, with no proteins, da, 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 da. All those since being pregnant might be TMI. I've been getting a lot of UTIs while pregnant. When you have a kidney transplant, you're at such a high risk for getting UTIs. I don't mean that you're nasty, so don't think that way, but your immune system is suppressed. So any little thing, if you hold your pee too long, which I do a lot, UTI, because I have a problem with when I'm asleep, I don't want to get up and pee. UTI. If you don't hydrate enough, UTI. If you don't flush or whatever, if you drink the wrong thing, UTI. So it's not like, oh girl, what you out there doing? So yeah, anyway, so I say all that to say, I had a visit with him 4 weeks ago. It was no UTI, and then the one I had last week, it was no UTI. So he's very happy about that. Well, he honestly thinks that I wasn't hydrating enough, because my creatinine wasn't bad. Creatinine is kidney function. It wasn't bad, but it was a little bit higher than what it normally was when I was having UTIs. Now that I don't have them, it's like running 0.7, 0.8, and I'm drinking a whole lot. So he thinks I just wasn't hydrating. Sometimes you don't realize that you are dehydrated. Pre-pregnancy, I could knock out about 5 or 6 bottles of water. While being pregnant, I was only doing 2 or 3, and I was forcing those down me. My taste buds and this baby just don't like water. So either way, I've been forcing myself to drink 4 or 5 a day. So yeah, so that's what we think it was. So anyway, tomorrow I go get tested for gestational diabetes, as well as just uncheck on baby again. So right now, I am seeing nephrology every 6 weeks. I am seeing my high-risk OB every 4 weeks, and I am seeing my regular OB every 4 weeks. So that puts me with seeing somebody like still once a week. I may go a week without seeing somebody, but yeah, about once a week. That the way my appointments run. So when I go tomorrow, I won't do a scan like how I do with the high risk doctor. My regular OB haven't been doing the ultrasounds. They just been doing the little thing they put on your stomach to just hear the heartbeat to make sure it's there. He mainly check on me. My OB check on me, and the MFM doctor check on the baby, and then my nephrologist is checking on me and my organs, making sure they're sustaining and doing well while pregnant. So yeah, that's kind of how it's going. So when I go tomorrow, they'll just check the diabetes, make sure baby's doing fine, which I feel her a lot now. And I know I made a comment before about, I didn't know how I felt about being pregnancy. I just wanted to be, I didn't know how I felt about being pregnant. I just wanted to be, transparent, because if I'm gonna do this, I want to be honest. I didn't know how I felt about being pregnant, but now that I feel her, it doesn't matter how I feel that in that moment, or what I'm going through, or what I'm thinking about, or how disappointed I was when I first found out I was pregnant. When I feel her, I can't explain it, but it just, I feel like an eternal, I don't know, I can honestly say, like, I love my baby. I don't even know her yet, but I love her. So I'm gonna leave that there. So that, that kind of helps with your anxiety too, when you're in the beginning and you don't know what's going on inside. A very active baby is a good sign. If your baby isn't active, it doesn't mean anything either. My son was active in the beginning of my pregnancy. When I got like in the closer to like the mid to late 20s, he was only active certain times of the day, like in the morning or around noon, and then at night. But other than that, during the day, I didn't feel anything really, like, all day. So it doesn't mean anything is wrong with your baby if you don't feel anything. But this baby, I've been feeling her since about 14 weeks. Yeah, and it sounds crazy because 14 weeks they like this big. But anyway, I've been feeling her since 14 weeks, and now that I'm at 20, I really feel her, and now I can put my hand on my stomach and feel her. So yeah, that gives me joy, and you know, it helps with my anxiety in between appointments. So besides that, just really quick, I've already recapped enough. If you have any questions, comment them below and I'll try to answer. I'm talking to you like I already posted this video. I don't know if I'm gonna even post it, but yeah, if I do, that's the instructions. So I'm going to continue praying. Number one, I told you before, you know, I'm big on God and Jesus, so continue praying. I want to start to, I don't know if I want to meditate completely or just have moments of silence with myself. I want to start that, and I will continue working out. I try to work out at least 3 times a week. My hips are beginning to hurt when I do certain things, so I'm going to try to do the pool. It's so hot though. It's just so hot. But my gym has a pool. But I want to take my baby to the pool too. So I don't know. I just may have to just be hot. But I'm going to try to do at least one of my workouts a week now in the pool. So I have been doing well. I spoke on morning workouts last time. No, that's not working. It's not. So I just deal with the crowd and come in the afternoon, come in the evening, come whenever I can. But I can't do the morning, so I'm not going to fake that. Maybe once she get here, I can go back to morning. So that's out the question for now. Still working out, not eating 100% my best, but still eating the best I can, taking my vitamins, taking baby aspirin that's supposed to help with preeclampsia, taking fish oil that's supposed to help. Study shows that Asian women, and I might be saying this wrong, so read this for yourself, they don't get preeclampsia, or they get it at such a lower rate compared to every woman. And when they found what was different, they have a higher consumption of fish, omega-3 in there. So studies have shown that helps. So I'm taking fish oil as well as vitamin D. That helps too, but I forgot why it helps. And then I'm also doing sea moss. I am doing I cannot think right now. I'm going to take notes. And when I come back, I'll be better at this. But yes, so, and I'm walking around the neighborhood on days I can't come to the gym. When I come to the gym, I work out in the gym, and then I'm going to add swimming. Like I said, the walking, it feels good, but sometimes towards the end, I try to do 1 mile. I can feel my hips, you know, getting kind of crazy. So yeah, and I've gained I'm pretty much at the full weight I was when I had my son. The full weight. I'm pretty much already at the weight I was when I gave birth to Zaya. So yeah, I'm sure all of that is the reason why I'm uncomfortable too earlier. So yeah, I'm gaining weight fast. That makes me nervous, but right now I don't care about all of that. I just want her to be okay. I want to be okay. The goal is to have her at 37 weeks and still have a healthy kidney function and still have my lupus in remission. Doctors aren't really worried about my lupus the way they are worried about the transplant. Lupus has known to once it's already taken a back seat, pregnancy doesn't really flare lupus up. Not saying it can't, but it's not at a rate to where they're concerned. However, lupus can still cause certain things to go wrong while you're pregnant, like the preterm labor and preeclampsia, but it's not known to flare up and wake up and just become like this full episode, or you're having a lupus episode. So those of you who just have lupus, not saying you're going to have it easy, but it's not as worrying as somebody who has had a transplant or who have lupus and a transplant. So count yourself blessed. So yeah, I don't want to keep talking. We're already almost at 30 minutes. I know I left some stuff out. I'm going to take notes. Thank you so much for listening. Have a great day.